Good morning, everybody, and thank you so much for being here with us today. I'm Hallie Nicholson, HR Strategic Communication and Engagement Manager, and I'll be your moderator for this town hall. We've got a great group of panelists with us today to provide some updates on our operations during the COVID-19 pandemic and to answer your questions. Some of the questions we're going to be answering today were submitted during registration. You can also feel free to use the Q&A window at the bottom of your screen to submit additional questions for our panelists. We've got folks here who will be answering them in writing and will take additional questions online as well. This webinar has live closed captioning available in two ways. First, you can click on the closed caption button at the bottom of your screen and select show subtitles, or you can also click on the link that was just pasted into the chat. So let's get started. I'd like to welcome our first presenter, Dr. Chip Schooley, Professor of Medicine, to start us off with an update about the COVID-19 pandemic. So Chip, take it away.
Thanks very much, Hallie. It's great to be back with everybody after the holidays. I hope that you had a good holiday and that you're as excited about getting back to steam as I am. As everybody knows, the holidays were marred by a big surge in cases with the Omicron variant kind of overtaking a good part of the US. The better news, though, is that things are turning around. They've turned around more rapidly in the East than out West because the variant got started there first, but things are clearly on the way down, both in the US as a whole. And next slide. In San Diego as well. The San Diego numbers are a bit noisy because the health departments had trouble kind of keeping up with the counts as they've come in. But the way that we've been following things, I think, more closely and getting a better idea about trending in San Diego next continues to be the wastewater. This is the work that Smriti Karthikeyan and Rob Knight's group do. They monitor the wastewater in Point Loma 3 days a week. And what you can see is that during the Omicron outbreak, we had nearly 50 million copies of viral RNA per liter in the wastewater in Point Loma, reflecting how much virus there was in the community. I'm sure everybody saw that with the number of cases you saw around you. That's about 10 times higher than we saw back during the Alpha and Delta outbreaks, to give you some context. What you're seeing on the right of the curve as it heads down, though, is what's happened over the last 10 days. Things have turned around and we're seeing a decline in number of cases and a decline in the wastewater. The wastewater has actually been a very good predictor where the cases will go. Last night's numbers will be, we didn't get because of a technical glitch, but we'll have 2 more nights of wastewater collection in the next day or so. So keep an eye on the wastewater site that you can watch on the search website that is updated frequently. Next. In the wastewater, sequencing is also done, and you can see that over the period that we've been talking about, Omicron basically ran Delta off the road, reflecting the better fitness of Omicron in our population and the fact that it's not as well shielded by the vaccines that we've been using. The good news is that although we've had a lot of cases, we haven't had as much morbidity and mortality with Omicron as with Delta. A lot of it's because of the vaccination, but a lot of it is because this strain seems to be not quite as virulent as it had been in the past. Now, don't get me wrong, people are dying of the Omicron variant. We have a large number of unvaccinated people, and a lot of them are in the hospital. And so it's not a benign, it's like the flu variant, but it's been less severe than the Delta variant overall. And clearly the amount of disease caused by it has been ameliorated by vaccination. We have in the hospital now about 160 people with SARS-CoV-2 infection. Almost half of them are in the hospital for other reasons. They're having a baby or having something else going on. But of those who are in the hospital for SARS and COVID, most of them are unvaccinated, which kind of reflects what we've seen throughout the whole epidemic. Next slide. Now, things on campus. It's hard to see some of these data, but this is on the RTL website. But if you look at the yellow lines embedded in the green humps, what you can see is the positivity rates have been declining first on the left in our student population and down around 2% now in the on-campus student population. They've been declining drastically among our employees on the right, and you can see we're down now to test positivity rates of around 4%, which is quite a bit lower than we were at the peak, again reflecting a turnaround of the epidemic around us. Next. Student cases are down as well. We had a little bit of a surge of cases as people came back to campus. Early on in the month, as people began to trickle back from the holidays, they were coming back at a time when the positivity rate in the community was quite high, and we had quite a few people that needed to go into our isolation housing. Was run extremely well by HDH and the Student Health Service. And we were able to take the students who were infected, give them a timeout until they were able to come back in the student population. And as students have come back in now, as the pandemic is cooling, you can see in the middle panel, fewer and fewer positive cases each day. We had kind of a spike in campus employee cases about the middle of January as well. You can see we're down now to 10 to 20 cases a day, which I think will continue to tail off over the course of the next week or two as we move past the Omicron surge. Next. So where are we now? We've been through now 4 surges: the initial surge, the Alpha strain, the Delta strain, the Omicron strain. It's beginning to pass behind us. Next. For those of you Greek scholars, you know the next thing will be the Pi strain. People have been saying that will start on March 14th, 3.14, but I think that's speculation. The bottom line is we don't know what's going to happen next. We know the virus evolves. We know that the other RNA viruses evolve. We can expect to see other variants emerge. Having said that, as we have more and more immunologic experience in our population with people who have been vaccinated past the infections, the virus will have a harder and harder time getting around. And while I expect there will be additional surges, I don't think they'll be as frequent or as dramatic as the most recent Omicron surge if we continue to keep our vaccination rates up. One of the things about coronavirus infections is that the human immune response doesn't remember them as well as we do many other infections. And the immunity begins to wane not too long after you've recovered from your infection, which is why before we began to have SARS, the older coronavirus strains that have been circulating in the human population for 800 years come back every 2 or 3 years. Our immune systems forget about it. We don't have vaccines for those, but we do for this. And I think with continued attention to vaccination, we can really begin to smooth these curves out and start heading back toward a more normal existence. Next slide. People have asked about the boosters. This is a new paper that was published about 3 days ago. And what it does is looks at your protection against the Omicron variant after different stages in vaccination. So starting at the left of the slide, you can see that after your second dose of an mRNA vaccine, in the black bar, there's a high level of antibodies to the original strains of this virus. And you can see you're barely protected against the Omicron strain in the red, with the red dot, just barely above, some people just barely above that line. And as you begin to get farther and farther behind your vaccination dose, you can see that in the next panel, 8 or 9 months, 7 or 8 months after the after your first 2 shots, your immunity to the original strains is beginning to drop, and the Omicron protection is really very low. But you can see that a month after you get your booster, both of these rise briskly, particularly the Omicron variant immunity. And that's one of the reasons why we've had so little trouble with people actually being hospitalized with the Omicron variant. The booster vaccination helps a lot. So I'd encourage all of you to who haven't yet been boosted to get out there and get boosted. They're widely available. Next slide. The last thing I want to talk about is the discussion about whether natural immunity or vaccine-based immunity is, quote, better. And the take-home message, if you don't want to bog down in the slide, is they both help you in terms of being able to reduce your likelihood of becoming infected and becoming ill. But they're not independent of each other. If this is some work from the Cleveland Clinic, and if you start on the left side of the slide and look at the red line, these are people who have not yet been vaccinated, kind of carrying forward until today. And what you can see is that over time, the people who are unvaccinated, more and more of them became infected. The most recent rise occurred during the Delta burst. In the other three lines, you can see not much happens for a long time, and that's just more and more people get vaccinated, they join that group. Then we began to see breakthrough infections in those who've been vaccinated. That began to happen kind of 8 or 9 months after the vaccine started. We knew that already. We also knew that people who had been previously infected with COVID would get infected, and they began to have reinfections as well. But if you look at the blue line on the very bottom there, people who've had both COVID and vaccination do better than anybody. So the point really here is, if you've had COVID, getting a vaccine, getting your booster shot will help you even more. And so please continue to think about that as we move ahead and try to combat this virus and help us stay on an even keel. I'll turn this over now to Dr. Sosha. Thanks very much.
Thanks, everyone. And Chip, thanks for laying the groundwork. It's so important to understand how complex this virus is. When you understand those pieces, you'll understand the strategy that we're trying to promote for campus safety. And part of that, of course, is keeping your immunity as much up to date as possible through vaccination and then through subsequent boosters. And right now, boosters are widely available, vaccination at the Price Center and boosters. The timing, when should you get, if you've been vaccinated with a primary series? Pfizer and Moderna, it's 5 months after completing the initial series. Okay, and then AstraZeneca or J&J, it's 2 months. For the international vaccines, they are really not giving much protection at all. So we're recommending individuals get a primary dose of a messenger RNA as well as a second dose to give optimal protection there. If you're immunocompromised, please speak with your provider. I think these cases are very unique, and some of them will recommend that you actually get a boost sooner than these timeframes. We are now able to vaccinate our children between the ages of 5 and 12, and these are available at the health system sites, but not at the Price Center. So for pediatric care, health system does offer primary vaccination, and eventually they will also move into a booster option. A lot of questions come up because we've had so many positive infections recently. I was due for a booster, but I recently had COVID. What should I do? And we're recommending that you get boosted 30 to 60 days after your infection. Your infection gives you a bump in your immunity. So having a booster there immediately, it's not dangerous. It's just you don't get the best benefit. So we're recommending a 30 to 60 days. We're going to talk a little bit about the mandate and what the requirements under the mandate are. But clinically, we're encouraging folks to get those boosters 30 to 60 days if you've had a recent COVID infection and you're eligible from your primary series. Next slide. So we now have some new language we have to get used to. We've been using the term fully vaccinated. That is going to transition to up to date in your vaccination series, because as more and more information comes out, it looks like we're going to have ongoing needs for periodic vaccination to address this virus over time. So for now, for the current up to date or fully vaccinated definition, it's you've been boosted when you're eligible and 7 days have occurred. You don't get immediate protection. It takes a couple days to get the kick in. But once you're after that, you are considered to be fully vaccinated or up to date on your vaccination. Okay. The other way is you've received your initial primary vaccination series and you're not yet eligible. So you remain fully vaccinated, up to date. You're considered not fully vaccinated or unvaccinated or not up to date if it's been recent, you just got your booster, it's less than 7 days. You've had your initial series and you're eligible. We've gone beyond the 5 months if you had Moderna or Pfizer, but you haven't had your booster. So you're eligible, but you haven't been boosted. All right. Or you have only done part of your series. Let's say you only got 1 dose of Pfizer. So you're partially vaccinated. And the other are the individuals who are unvaccinated, and hopefully category who's working with us and learning with us has an appropriate exemption, a religious or a permanent medical exemption, and you're not going to be vaccinated. Next slide. So the mandate has incorporated boosting and maintaining your full vaccination or up-to-date vaccination status. It is considered covered by the mandate. Current deadline for compliance is January 31st, which is right around the corner. All right. Once you become eligible For your booster, healthcare workers have 15 days in which to be boosted, and employees and students have 30 days. Again, if you've had a recent COVID infection, we are aware of it. If we know we did the test at UCSD, it's in Epic. If you had an outside diagnosis, please have it entered into Epic. You can do that if you're a student through Student Health Services, they'll do it for you, or the COVID testing line will do it for employees. This extends your eligibility another 90 days. All right. That extension for healthcare workers has been up in debate. It may not be the full 90 days, but for now, if you have had a recent infection, again, you get an extension on the time frame for the boosting. All right. And if you have a currently approved exemption for vaccination, that will also cover you for boosters. So if you are an individual who has a religious exemption or a permanent medical exemption for vaccination, that will also apply to boosters. You do not need to submit another request for an exemption. Next slide. So how have we changed our testing requirements in light of Omicron and its significant easier transmissibility? If you're unvaccinated, or if you are in that not yet fully vaccinated or up to date with your vaccination series, and you're on campus for any reason, you're required to test twice weekly. That should be no less than 3 days and no more than 5 days apart. So again, unless you are in the category of fully up to date and boosted, you need to test twice weekly. If you are boosted or you're vaccinated and not yet eligible for your booster, you test if you want to. We encourage you to do that once a week. Everyone, regardless of your vaccination test status, should test immediately if you have any symptoms of COVID-19. And if there's wastewater in the building in which you work or live, please take advantage of testing. However, there's one caveat to this. If you've recently had a COVID-19 infection in the past 90 days, we don't want you to repeat your test and you're exempt from these testing requirements. That's because some individuals still said some viral particles, which will show up in our very sensitive tests. You're not necessarily infectious. You aren't infectious after you've completed your isolation period, but you may still shed some fragments of the virus. And we don't want you to get a positive test that creates confusion. There's one time when you do test, and I'll talk about that after you've had a diagnosis of an infection, and that is rapid antigen test for isolation management. And we'll be talking about that in a little bit. So again, going over the testing requirements is if you are coming onto campus and if you are unvaccinated, or if you are vaccinated and booster eligible, but not boosted, or you just got your booster within a week, please test twice a week. If you are boosted, up to date, fully vaccinated, we encourage you to test every week. Next slide. And to remind everybody, the vending machines are working. You have access to those. You need your campus ID to access a kit. The kits are only to be used for you as an individual. Please don't give them to other individuals. And the kit is identified by using the UCSD app. You have to capture the barcode on the little vial. That actually then links to your identity through the app. And that's how we get the results to you. If for some reason you don't see your result, you should test the next day. If you're not, for some reason it's not picking up, then reach out to the COVID testing line because something seems to be off. Most people are getting the results within 24 hours, sometimes even the same day. Pickups out of the vending machines end at the mid-afternoon, so try and get your tests in earlier in the day. That's much better. Then you have a great chance of getting your result back even that evening. Masking. Because Omicron is more transmissible, we're increasing and recommending that you use a more tightly fitted mask. You'll notice the difference when you start wearing a KN95 or an N95. It is a tighter fit, so it reduces the chance that you will inadvertently pick up virus. If you don't have access to that, and we'll talk about how you can acquire free KN95s on campus, but if for some reason you don't have that at home, another thing to think about is a surgical mask with a cloth covering. So putting 2 layers there is another added protection. When are you required to mask? When you're indoors. It's really critical that anytime you are indoors, unless you are alone in an enclosed office, you should have a mask on. We're asking that there is no food or drink at any indoor meeting, and that you have Zoom options for your meetings. As we continue to work through this surge, things are very encouraging. You saw the numbers. It's dramatically better than it was a few weeks ago, but we still have a fair amount of virus around. And so we need to rely on this masking. It is extremely effective. So please make sure you are always with a mask. Use the better fitting masks. Take advantage of them at all times. Our students are returning. They're in phase 1, which means they are masking in all the common areas, but not in their bedrooms or in the showers. Next slide. I want to go over some of the requirements. These have changed a little bit about isolation. And this is a new that happened over the break, and it changed a little bit from CDC in California. We are following the California Department of Public Health requirements, which I think are very good. And that is that you have 10 days of isolation from a positive diagnosis, unless you meet 3 criteria. That is that by the time you've reached day 5, you're without a fever, your symptoms are gone or very much resolving. You have a negative rapid antigen test, and that is done on day 5 after you've been diagnosed or started your symptoms. If that test is negative, then you are really not shedding an amount of virus that makes you infectious. We still want you to mask around others for the complete 10-day period. So you're able to leave isolation, leave a single bedroom, that's where you should isolate, after 5 days if you have a rapid antigen test. So these are available for employees. You can get them on the RTL site, and you'll have access to a rapid antigen test. To be able to come back to work, you need to have a provider or an observed rapid antigen test, not a self-administered test. Our students, we're allowing them to use self-administered tests. So please take advantage of the rapid antigen tests in the management of isolation. The rapid antigen tests as a diagnostic early test are not as effective as the PCR. So we continue to rely on PCR testing, our vending machine or price center or health system drive-up testing, PCR, as the best diagnostic test. And it is certainly a better test in the early phases of an infection. So rapid antigens, while they're convenient and useful, they're not our primary tool, and they're not our surveillance tool that we're recommending for campuses or for students. It's a little difference there. Next slide. Quarantining. So if you have been boosted and you're fully up to date on your vaccination series, you're not eligible yet, you can continue to move around. You don't need to stay in place. You don't need to stay out of work. We encourage you to test as soon as you know about an exposure, and on day 5 as well. And you should mask around others for 10 days in case you do convert, but you don't need to remain isolated, and you can come to work. If you are unvaccinated, or if you have been vaccinated but are beyond your window of eligibility, you've not received your booster, then you need to stay out of the workplace. This is for everybody except healthcare workers. It's a little different for primary healthcare workers. For all our other employees, you stay at home. And if you have a day 5 test, which can be a rapid antigen test administered by a provider or observed, not a self-done test, and that is negative, you can return, right? Again, you can't have symptoms, and you need to continue to mask for 10 days. So there are some changes here that have been created based on this virus's rate of transmission and conversion. So by day 5, most exposed people will have defined themselves. We ask for masking for 10 days because there are rare individuals that go beyond that 5-day period. So this is a new change. So I just want to make sure folks know, because we've had a lot of infections and we have a fair amount of exposure. So if there are any questions about this, we'll cover it again in the chat, but this is available. All this information is on the RTL site. Please take advantage of that. We've really tried to keep it up to date. Next slide. And how we try to keep things a little better for our students returning is we actually pushed our students and encouraged them didn't push them. We encouraged them to return later, to let the surge move through various communities in California and the western part of the country, throughout the country, so that the rate of viral activity when students returned was lower. We also gave them some of these self-administered tests as a potential screen so that they were positive, because when they're positive, they're good. The problem is if they're negative, they may miss an early infection. But if they're positive, then you have an infection, COVID infection going on. We're asking students to delay their return. And this has kept a number of our students staying at home, isolating with families or friends instead of coming onto campus. And all students are having a PCR test, regardless of their vaccination status upon arrival. And we've picked up a number of our students who are positive. And we continue with ongoing surveillance, the twice weekly surveillance process for all of our students as well. Off-campus students outside of San Diego County, we sent them some rapid antigen tests as well so that they could adjust their travel. And we've encouraged all of our off-campus students in San Diego to also test 24 to 48 hours before coming back to campus. So we've tried to minimize the chance that students will bring more virus back to campus, share it with each other, et cetera. They've been doing a very good job, and the numbers are really dramatically better than they were a few weeks ago. And so we've made some really good progress, and we're very optimistic things will continue to improve over the next few weeks. All right, I'm going to hand it over. Thanks.
Thank you so much, Dr. Socha and Dr. Schooley. We have been so fortunate and continue to be so fortunate to have access to your medical expertise. So thank you for that. Next up, I'd like to introduce my colleague, Terry Winbush, Senior Director of Labor Relations and Employee Relations, for some updates from the HR side of the house. So Terry, take it away.
Thank you, Hallie. Hello, everybody. Good morning. Thank you for joining us for an early in the morning town hall. I hope you've had your coffee and so that all of everything is firing on 100%. So I wanted to take some time to remind everyone that while we are all going through this together, please take care of yourself and show grace to others. And I say that to mean COVID has impacted almost everyone in some way, shape, or form, whether it's colleagues having COVID in their work unit, whether it's family members having COVID, whether it's you having COVID yourself, your children, COVID is impacting everyone. And so that means that there will be delays as it relates to work because people are not able to work or are not able to come on site. Some project timelines probably need to be adjusted. We wanted people to really think about this month in particular in January, and then probably the first few weeks in February, think about offering these adjustments to the folks you supervise. If you're a client or a target recipient of someone doing work, show grace when they need to ask for adjustments, but you should also offer them to them as well. So if you normally send something and you say, you know, this is normally a 2-week turnaround, so will that work for you? Maybe you can adjust it and say, you know, with 4 weeks work, you know, I understand that everybody's being impacted from a staffing perspective. Also understand people might be a little bit more quick to be frustrated. I'll say it that way. And so show them grace, because sometimes all they need is a smile that day to change their outlook because they've dealt with something negative on that day. So just really be kind to yourself and to others. Pay attention to your body. Don't ignore that sneeze. Don't ignore that cough. Do not ignore that tickle in your throat, because those are all things that we would recommend you likely get tested and take advantage of the wonderful testing options that we have at UC San Diego. A reminder, and thanks for putting it in the chat, there is still 2021 EPSL, and people say, but you know, Terry, it's 2022. What are you talking about? Well, the 2021 EPSL does not expire until June 30th, 2022 for those employees who were our employees on or before September 30th. And they've either, they are either sick due to COVID and need to take care of themselves, or they have to care for a child or family member due to COVID. Or other reasons. Up to 80 hours of this 2021 EPSL are available to the extent that they haven't already been used by you. Additionally, there's Cal OSHA leave. And this is the leave that really helps those folks who otherwise are well enough to come on site to work, but we are preventing you from coming to work because you have COVID or you have an exposure, as Angela described earlier, and we're preventing you from coming on site, the Cal OSHA leave will pay your pay for up to 10 days for any time this happens. So if you're exposed this week and prevented from coming into the office, and then it happens again in 2 months, God forbid, and you are prevented from coming into the office and your work requires you to be on site and you're otherwise well enough to work, then the Cal OSHA leave can cover your pay during that time. So don't forget about these options. You don't have to memorize the eligibility or anything like that. That's what your wonderful colleagues in HR are for, and your HR departmental contacts. So just reach out and someone will be able to help you with whatever options are available to you given your particular circumstances. But please do not feel like you need to come to work sick. We need to let that go in our culture, because that is not the way that we need to move forward. Do not come to work sick. That's why there are leave options available, as well as your leave accruals if for whatever reason you aren't eligible for the 2 leaves listed on this page. So if you have sick leave, there are other options for you to take in order to take time off to take care of yourself. Next slide. And then, as Angela discussed a little bit earlier, related to our UC vaccine mandate, new employees have 2 weeks from their start date to demonstrate full vaccination. The booster requirement is now built into that initial mandate. Now, some of you HR contacts out there know, those of you who are UC Path transactors know, and some of you new employees know, I may not have access to everything within 2 weeks. What do I do, Terry? You do the best you can, and just know that we don't immediately fire you if you haven't updated that information. We will reach out and give you an opportunity to let us know what's going on if your access hasn't been updated, et cetera, and we will work with you. The goal is to get your information updated and not to take negative action against you. Now, the deadline for all campus employees who are eligible for their booster to get boosted is January 31st. If you are not yet eligible as of January 31st, you will have 30 days from your day of eligibility to be boosted to get boosted. So I'll say that again. If you are not yet eligible as of January 31st, so you say, look, Terry, 5 days from now is not going to be the amount of months that it needs to be post my last primary vaccine. So what does that mean for me? Once you become eligible for the booster, you have 30 days if you're a campus employee to get boosted. And I emphasize campus because there are different requirements for our primary healthcare workers, as Angela mentioned. Now, there's the additional caveat, because in this wonderful world of COVID, there have to be 67 caveats and other offshoots and triangles that you have to figure out which thing applies to you. So if you have had COVID in the last 90 days, you do get an automatic temporary medical exemption for 90 days post your PCR test. But how do we know? Well, if you got your PCR test through UC San Diego at a drive-up location using one of the vending machine tests, or you went to our Price Center site, then we know that you had a COVID positive within the last 90 days. If instead you went to another provider and were tested through a PCR, you'll need to send your test results to us so that we know that you need to get this temporary medical exemption. Otherwise, we will think that you are just blowing off the system and not following the rules. No, we won't assume that. We'll just assume that you probably need help on getting us the information. So there's information on all the RTL sites on how to do this. And you can also check in with your HR contact to help support you in getting your information sent over to our COEM folks, who can then have this into our information so that we know that you get an exemption. So there are a lot of questions about, so are we really going to end the more liberal remote work on at the end of this week, and so that everybody can start to return on site on Monday? Yes, that is the case, because the numbers are really looking so much better. Our wastewater testing that Chip was showing earlier, and the other numbers within UC San Diego and San Diego County are looking so much better. Note though, that if a meeting can be held remote, please leave it remote for now, unless it's operationally critical to be held in person. And we say that because we know that when the meetings are in person and you're wearing the mask, People want to stop and take that drink of water. We don't want that to happen, but we also don't want you to dehydrate, right? People want to have their sip of coffee so they can be functional in the meeting. Well, you cannot do that, but we also don't want you non-functional. So let's prioritize having the meetings remote for now, unless they're operationally critical to be conducted in person, because there are a lot of things that need to happen in person. For example, lab work and things like that. That happens in person, and people have meetings in those environments, but they will be masked indoors for sure. The other thing that people have asked is, well, are we all required immediately to return on Monday? No, really talk with your supervisor, your department heads. They can talk about what makes the most sense for your unit and the type of work that you're doing and what's currently scheduled on the horizon. But the expectation is that people will start to return on next Monday, or in line with whatever their current work arrangement is, per all of the communications that we've been sending out and that the chancellor has sent out. So I hope that was really helpful. And so now I'm going to turn it back over to Hallie.
All right, thank you so much, Terry. It looks like there's one more slide here.
Yeah, that's right. That's right. I'm so sorry. I had 3 slides this time. You know what? I'm just talking you all to death, and please forgive me. So on the horizon, there are things that I want you to just have in your mind that are coming up that are not COVID related. They're just about like work, you know? And so we have a series called Supervising at UC San Diego. We've heard a lot from our supervisors who want more support around what does it mean to be a supervisor? How can I be the best people leader I can be? I want to be a great people leader for my staff, and I want to espouse the UC San Diego principles as I'm leading. So we have a Supervising at UC San Diego series that goes over the overview of most do's and don'ts for supervising at UC San Diego, grounded in best practices, focusing on, laws and regulations, but also the good people leading advice. And this complements our supervising training laboratory, or everybody knows it as Soup Lab, where we talk about specific managerial skills. Additionally, and I don't want to freak anybody out, but part of the reason we bring it up now is so you have plenty of time to marinate on this and have the best outcome for your self-appraisal and for those that you appraise. So if you're like me and you try and think about your accomplishments and goals in that time where your HR contact says, self-appraisals will be due on so-and-so date, and you're like, that's in 2 weeks. What have I done over the last year? What have I done? Don't wait until you get that notification. Start thinking about it now. It's a lot easier when you're not under that time crunch to start documenting the wonderful things that you've done over this last year in this performance appraisal cycle. And I know you've all done a lot of wonderful things because I've heard about a lot of those things. So take the time now, document those things. And then when that notice comes out from your HR contact and your supervisor about your self-appraisal, you will be ready. You'll be like, here I am, and here are all my accomplishments. I am amazing. Hear me roar, recognize me. And then you as a supervisor also think about all of the accomplishments and accolades of the folks that you supervise. Start thinking about that now so that you can drown them in gratitude in the appraisal cycle when the time comes. So with that, I'm really going to turn it back over to Hallie. And thank you, Hallie, for reminding me of my last slide.
Right, important information. I didn't want us to miss it. So thank you very much, Terry, for those updates. I wanted to share, as Angela referenced, just some information about where staff and students can pick up KN95 masks. So we know, as Angela shared, with the Omicron variant, we're learning that these KN95 masks are a better mask for this situation. So we want to make sure that our staff have access to those. So individual employees can pick up no-cost KN95 masks in 2 locations. So you can go to the Price Center East level 2. So that's the entrance to the East Ballroom. Head up the stairs behind the Triton statue. The hours are here on the screen, and you can pick up your KN95 mask. I think when we move into the Q&A, I'll ask Angela and Chip to maybe talk about these masks can be reworn, but what is some advice for how often to rewear these masks, or kind of keep a KN95 mask usable for you? So you can pick up one of those. You can also pick them up at the Trove at the corner of Library Walk. Hours are on the screen. You don't need to bring your campus ID for this at this point, so just come on over and pick one up. In relation to ordering masks for departments. So currently departments can place bulk orders for KN95 masks through Oracle procurement. And our logistics department keeps a large supply of those in stock, and this is at the cost of the department. So recognizing the increased need for these masks right now, plans are underway to make these bulk orders for departments available at no cost, but that's not ready yet. So my advice for departments right now is if you already have a healthy stock of masks, don't order any more to stockpile right now. Just kind of wait until the process changes a little bit. If your department is running low on masks, go ahead and place your order. So just wanted to share that information, and that'll also be coming out in our Return to Learn weekly newsletter. So keep an eye out for that. So moving on, for our final update, I'd like to welcome Jen Bowser, Chair of the Staff Association, and she's going to share some information about some things on the horizon for our Staff Association. So take it away, Jen.
Thank you, Allie. Good morning. Thank you to all my fellow panelists for sharing these important updates, and thank you for everyone attending today. I'd like to highlight a couple of upcoming virtual social sessions we have planned for staff. The first one is tomorrow at noon. We'll be hosting a craft demo with Craft Center manager Annika Nelson. Annika will demonstrate how to make jewelry beads by repurposing paper from catalogs, magazines, or leftover wrapping paper. The second event will be trivia on Wednesday, February 16th at noon. Amanda Chavez, who is past chair of our staff association and also the Council of UC Staff Assemblies, will try to stump us with questions, all things related to the month of February. And we do have prizes for the top point scorers. As for our Trite and Treat events, we have paused those for the time being. Our hope is to continue hosting those again, beginning sometime in March. Next, I want to mention that the Staff Association is excited to announce that we are currently accepting applications for our annual Staff Scholarship Award through March 15th. The program provides an opportunity to be reimbursed up to a maximum of $500. It is open to all UC San Diego career employees who are interested in advancing their careers. The scholarship can be used towards a professional development activity, which requires a fee, such as fees for educational seminars or workshops, conference registration fees, and also the coursework for professional development. The timeframe for consideration is July 1st of 2021 through June 1st of 2022. Awardees will be notified by April 15th, and reimbursement will be sent by direct deposit or check after confirmation of payment and course completion is provided. The application and full instructions are available on the Staff Association's website. Note that our scholarship chair, Cindy Meaves, does review the applications, and she will contact you if any information or documentation is missing from your submission. So in other words, your application won't be rejected automatically if you complete it incorrectly somehow. You have nothing to lose by submitting an application, so go ahead and put one in. This program is made available by our corporate sponsors, so thank you to Farmers Insurance Choice and SDCCU. Although it isn't on the slide, I'd like to mention that if you are looking to gain leadership experience, expand your network, connect with fellow staff, or influence staff priorities, consider volunteering with the Staff Association. We currently have one open chair position on our executive board. It is the basic needs chair, and the description can be found on our website. Additionally, we are always looking for staff to volunteer with our various committees, and you have full control over the time commitment and tasks that you sign up for. There are also 10 campus staff affiliate groups with different interests that are also a great way to get involved. And lastly, we have a strong presence on Instagram thanks to our amazing marketing and communications team of volunteers. This is the best way to stay current on the latest Staff Association news. We invite you to follow us if you are not already. Our handle is UCSD staff. And as always, you can find more information on our website of Staff Association at ucsd.edu. I wish you all well. Continue to stay healthy and safe. Be kind to yourselves and each other. And I thank you for all that you do as Triton staff. Thanks.
All right, thank you so much, Jen, for that information and for all you and your group do for staff. You've been such leaders for a long time, but especially over the past couple of years. So really appreciate all that you do. All right, so let's move into our Q&A portion now. Lots of questions coming in both before the event and through the Q&A box today. So I'd like to welcome Terry, Angela, and Chip back on screen with me, and we'll move into some of our questions. So we've seen quite a few questions today specifically about the potential for maybe a fourth shot or another booster. So the question, some of us are already at over 3 months after getting the booster. Any sense yet of how long our boosters will be useful? And then I'll follow that up with what are the prospects for maybe requiring a second booster? So either Chip or Angela, whoever wants to take that on.
It's too early to tell, when we're going to need another booster. I think we will because of this tendency of the human immune response to begin to forget about coronavirus exposure, coronavirus vaccine exposure over time. The real question is whether or not the booster we'll need will be one that will be more tailored to, for example, the Omicron strain or more contemporary strains that are circulating now. Pfizer and Moderna and others are working on vaccines based on the Omicron strain. Some people have said, why bother? Because the Omicron strain will be gone by the time they get the vaccine ready. On the other hand, the new viral variant that will jump out, the Pi, Rho variants, probably more likely to be coming from variants that are circulating now, the Omicron variant, than ones that were circulating a year or two ago. So I think it's going to be important to have a stable of vaccines available that we can get ahead of the curve if a new variant arises. But my bet is we'll need to be boosted every 6 to 12 months for a while until we get our immunity up. The old coronaviruses that we do very well with have had several hundred years to build up human immunity. We've only been dealing with this one for about 23 months, but who's counting? And the vaccines are helping us.
And to follow up on that, I think we should assume that if the recommendation is clinically to get a fourth dose, then that will come under the mandate and we'll just adjust for that. And that's why this transition to up-to-date concept for fighting this virus through vaccination becomes so important. So I'd be prepared for that.
Yeah, thanks for that reminder about the terminology from fully vaccinated to up-to-date. I think that's an important clarification. So Angela, just a minute ago, I shared about picking up these K95 masks. And as I was sharing that, I realized that I don't really have a lot of information about how often. I know my cloth masks, right? I throw them in the washing machine, whatever. So can you provide any advice as staff are picking up these K95 masks about how long they should wear them and when they should throw them away? Any advice on that front?
Sure. So I think this is a really valuable resource and we need to take advantage of them because they work so well. But they don't last forever. You can't wear one. If it becomes soiled or wet, then that one's not good. Okay. But if it's dry, you can wear it for 5 days. And those don't have to be consecutive days. So please take advantage of and don't just go through them so quickly so that we will run out, right? We don't want that. We want everyone to have them. We want easy access to it. But as long as it's dry, you can use it the second day. If you're alone in your office all by yourself, you don't have to wear it continuously, right? But if you're going to meet with someone, totally different situation, then you need to have that mask on. And if you've been in that office for a prolonged period of time, you may want to change your location, right? Because the virus will build up in an enclosed space. So we need to be thinking about how to outsmart this virus. All right. So please take advantage of those masks, 5 days of use, unless soiled or wet.
All right, great. Thank you. All right, Terry, this question is for you. Can we get our COVID test 24 to 48 hours before we return to the office instead of taking a test on the day of return? Wouldn't it be better to know in advance?
That's a great question, Hallie. And I know a number of people have that question in the Q&A. So let me explain a little bit of the behind the scenes. So first of all, please know that everyone will still be masked when they're indoors. That's the key, right? The test isn't going to necessarily protect you. It just provides you information. The mask is what is going to protect you and your colleagues. The other mitigation measures, not having eating or drinking inside meetings, not gathering in large groups, things of that nature, right? Like those are the things that will protect you. The testing actually provides information. Nothing is preventing you from testing before you are on site. We are simply requiring as a condition on your first day back on site to test. So we have obligations as an employer that when we require you to do things, we have to pay you associated with doing those things. And so if we require you to test before you come on site, that implicates things related to your hours of work. So now it's work time. How do we manage it? Things of that nature. So if you want to test before going on site, or you want to use one of the free federal government tests that you hopefully ordered, hopefully everyone got access to that. I'll make sure to put it in the chat if you don't know about it. And they are showing up a lot quicker than the federal government thought, because I already got mine. If you want to use one of those rapid tests to give yourself some peace of mind before you come into your PCR test on site on your first day, you can absolutely do that. But the requirement, the absolute requirement, is that you test on that first day back on site if you haven't otherwise had a COVID-19 infection within the last 90 days. So that's what we're doing. So we're focusing on the actual protection measures. You mask, right? You keep washing your hands. You don't eat and drink in groups of people. You don't be in large groups of people. Those kinds of things, those are the primary requirements. And then you test on that first day on site. So it's not that we're ignoring the wonderful access to testing. It's just that we want to do it in a very thoughtful way to make sure that everybody is able to do so in line with our other requirements. So I hope that helps everyone.
Just to follow up about that, another question we got a couple times is, so regarding this initial testing requirement, is that a one-time, just kind of a one-time requirement, when you come back to campus?
So it depends, right? So if you are fully vaccinated under the definitions that Angela provided, if you are fully vaccinated, that's a one-time requirement, right? So a little information about me: I'm fully vaccinated and boosted. So I have a one-time requirement on my first day back in the office next week. I will do a PCR test that day. Now, I'm a tester for my pod, so I'll be testing weekly because it is still encouraged. It's just not required. But for those folks who are not considered fully vaccinated, right? Meaning they're eligible for their booster, but they haven't yet received it, and they haven't otherwise had the COVID-19 infection, or they haven't completed their primary series of the COVID vaccines, right? If they haven't done those things, then they need to be testing every 3 to 5 days in addition to that first day test back on site. So people really should look at the testing policy and then confer with either their supervisor or their HR contact if they need more advice. But it depends on their circumstances on whether or not they need to test. They are required to test beyond that first day back on site.
All right, thank you, Terry. So, topic of testing, let's talk about rapid antigen testing. We've seen quite a few questions pop up in the chat in advance about those. So some of the questions, I'll throw these to either Angela or Chip. Some of the questions include, how many days could it take for your rapid test to be positive for Omicron? What's the percentage of accuracy? Anything we can do to ensure maximum accuracy, maybe doing those tests yourself? So what advice and information can you share about these rapid antigen tests?
I'll start on this, and Chip may add more about it. The rapid antigen tests are a real positive in a number of ways, or very helpful, I should say that term. Whenever you say positive around here, it means something different. They're very helpful in certain settings. Where we're using them quite regularly is to manage isolation, so that if you're in isolation and your symptoms are gone and you don't have a fever, we are able to come out of isolation with a negative test on day 5. Purposes, you can come back to work, right? If you've had COVID and your symptoms are gone after day 5, that has to be an observed or provider administered test. It can't be a home test. So for employment purposes, you need something a little different, and that's available. You can go right through the drive-up sites to get that. So that's another use there. Quarantine. If you are in a quarantine, an unvaccinated, not fully vaccinated person, and you've had a definite exposure, and you're 5 days out from that exposure, a negative test then allows you to come back to work. So those are great uses. The other is a good screen, right, for infection. We are not recommending it as the primary tool, though, and we're not switching away from our PCR. We're staying with PCR as our primary surveillance and required testing. We then have that result in our records. We can use it for compliance and for other, purposes. And it's a more accurate test, particularly in early infection. I think this is the important part about that early on, the rapid test right after an exposure may miss an infection. So we're staying with PCR as the standard surveillance test and diagnostic test.
All right, great. Thank you for that information. All right, so question for Chip. What are the symptoms for someone who has contracted the Omicron variant, and are they different from previous variants?
It's actually interesting as we learn more about this, it tends to, on average, appear more like an old-fashioned cold, a sore throat, a runny nose, sneezing, more virus kind of growing in the upper part of your nose and your mouth. And that, in fact, is what you see in the laboratory. The virus grows better in cells that come from that part of us than from our lungs, which is probably why it causes less pneumonia. We don't see as much of the loss of taste and smell with the Omicron variant than the prior variants. There is some crossover, and you can't tell for sure. The biggest trick is that it's difficult to tell from the flu, and some people can mistake it for allergies with sniffles. So you should have a low threshold for getting tested if you have these symptoms, and not just assume it's the flu or something else. But it's a great question.
It's a good reminder about kind of the low threshold. So thank you to the person who asked that question. All right, question for Terry. What options do supervisors have in providing more flexible hybrid remote options, especially for staff who are currently remote?
So this really has to be in line with the VC requirements, right? So they really need to work with their VC HR contact and then cascade that information down to the HR contacts for that VC area. But this is in line with our sort of re-envisioning how we approach work in general, right? Like separate and apart from the pandemic. While the pandemic gave us a lot of information and insight about the efficacy of remote work and how we can engage with each other in ways on Zoom that we never thought of, right? Like I would have never known Chip or Angela and so many other people, but for the Zoom capabilities and then unfortunately the pandemic, but I plan to be their friends forever. Really taking a look and stepping back and figuring out what makes the most sense for their operations, right? Whether it's offering more remote offsite, type work, whether it's some more flexibility and hybrid options, whether it's just an alternative work schedule. Maybe someone would work better and offer better options to their clients because people really need to have some evening service. We have a lot of staff who work at night, right? But some of our services are only day. And so then it becomes an issue of trying to have meetings at 6 a.m. to accommodate the end of their shift, or having a meeting later to accommodate their shift, when if we otherwise just had services available, we wouldn't have to go through the hoops of jumping and keeping them up longer than they would need to keep their circadian rhythm in check, right? When they need to go to sleep and wake up and things like that. So people really need to just be thinking creatively. Like one thing that this pandemic has showed us, and it's continuous raging on, is that this is going to be with us in some way, shape, or form forever, right? And so we really need to be thinking about how do we provide the best experience for our faculty, our staff, our students, our research enterprise, everything that we're known for in UC San Diego, our innovation, the way that we always are going out on the limb and having others follow us. This is the time to really think about that as we approach work. Like we talked about this a lot last year. We talked about this some the year before. It's not going away. Covering your head and your eyes and burying yourself isn't going to get you there. So people really need to take a step back and relook at it once again.
All right, thank you, Terry. So $1 million question for you, Chip. How close are we to the pandemic being over via maybe the number of people vaccinated or herd immunity? What is the science pointing toward, if anything?
The science is pointing toward less viral activity and less severe viral activity in those who are developing immunity from vaccination and prior infection. I don't think it's going to be over so that this coronavirus is going to go away any more than the one that was introduced 800 years ago. I do think that over time, it will cause less illness in people who are healthy. Many viruses like influenza have been with us for a long time, and it still causes severe disease in some of us and kills older people and kills younger people. And this coronavirus will, being realistic, will likely do the same thing. The good news is we still have extremely good tools to deal with it. We have vaccines that are good and getting better. We have drugs that are good and getting better. We have much better drugs for this than we do for the flu, and we'll see more and more of those available in the summer. So we've learned a lot scientifically as well over the course of the last 18 months, and As much of an upheaval as this has been for the world, think what this would have been like if it had occurred 20 years ago. We'd have been really been no way to develop the testing. We wouldn't have a vaccine. The drugs would not be available. We've really, I think, as a overall scientific problem-solving community, done a very good job. Now we just have to translate those advances to the broad population and have people be able to take advantage of them, both those who want them and can't get them in places that aren't as fortunate as the US, and to have our colleagues in the US who have been reluctant to take advantage of them, learn about the benefits and talk through some of the concerns so that we can more and more get back to what we all want to do, which is life with masks less often, masks less frequently, and more time to be with friends and family without always looking over our shoulders. We're very, very much farther down the road this year than we were last year at this time. And I think this is going to continue moving forward. So I think optimism is something that is really warranted at this point with where we are.
All right, thank you, Chip. I think that's a great note. We're at our time today to end our town hall. So I want to thank you for sharing your expertise. As always, all of our panelists, both on camera here and also our panelists behind the scenes who have been answering questions in the chat. Planning is underway for our February town hall toward the end of February. So keep an eye out in your email and your updates from HR Campus Notice for information about that town hall. So with that, we'll wrap things up today. And I just want to thank all of you for being here and being such an active part of this discussion as we continue these events. So thank you, everybody, and best wishes for a great day and a great rest of the week.